Always one step ahead. The Age of Spinal Medicine medical documentary. Proudly brought to you by the Southeastern Spine Institute.
Welcome to the Southeastern Spine Institute's The Age of Spinal Medicine. I'm Angie Mazzell.
And I'm Vanessa Hill. This is the 10th in our series of medical documentaries to help educate the public on the new advancements in spine medicine.
We want to let people, maybe like you, know that you no longer need to suffer with back pain.
I didn't have any pain, none. It disappeared.
It was like a burden had been lifted off my shoulders, and I had a whole new life. I was given my life back.
I'm happier, much happier. I've lost a lot of weight.
The Southeastern Spine Institute is a complete medical spine center. Here, specialized physicians working in multiple disciplines can diagnose and treat almost any type of back or neck problem with the latest technologies and procedures found anywhere in the country, and often in the same day.
It's why people come from all over the country to seek medical treatments. During our show, you'll meet people who thought they would just have to live in pain. But after coming to Southeastern Spine, they're now able to get back to a normal life.
They completely take me out of pain, completely.
And now I can pretty much do anything else that I was doing before.
I'm back up like 90%, baby, 100%.
And join me as we speak to medical doctors and professional staff here at Southeastern Spine. They'll explain some of the latest technologies now helping people get out of back pain.
We try to stay right on the forefront of that. We try to do things as small, as easy as possible.
We've seen that patients are having better recoveries and ultimately better outcomes.
There's a treatment option available for you that can help you with your problem, even if you've been told there's nothing that can be done.
So stay tuned as we go on location to explore the latest in spine medicine.
And learn how people maybe like you can finally get out of back or neck pain.
The Age of Spinal Medicine on location. Brought to you by the Southeastern Spine Institute and Ambulatory Surgery Center. Once again, Angie Mazzell.
Our first story is about a man who waited patiently for his son to return home from Afghanistan. In fact, he even planned a lifelong dream of a hunting trip out west upon his return. But as the date neared, something very dramatic happened.
I was the lead pallbearer on the right-hand side, and as we stepped out of the church is when it actually ruptured, and the pain was so sharp and so severe until I almost dropped the casket.
He's the love of my life, and it made my heart hurt to see him in so much pain.
Ron Gooding's injury at his mother-in-law's funeral changed his life. He was once a very active, outdoor kind of guy, but all of that ended after he hurt his back.
I couldn't come up to my farm, I couldn't work, couldn't go bow fishing. New hunting was out of the question.
And so was that dream trip with his son.
I was in so much pain, eating so many pain pills that I don't even remember the days.
But Ron did remember the Southeastern Spine Institute, and he knew if anyone could help, it would be them.
Ron had something we call a spondylolisthesis, meaning he had normal motion at one segment of his lumbar spine with pressure on the nerves, which is causing a lot of back pain and leg pain. Doctors usually ask you what your pain level is, from 1 to 10. And when mine ruptured, it was beyond 10. We tried a variety of non-operative measures, mainly injections and therapy, which were helpful for him to some degree, but eventually his pain got to the point where he was looking for other options, and he had a problem that we knew would respond well to surgery. My son was in Afghanistan for 9 months, and we had planned this hunt as a father-son reunion get-together time. I really had my doubts whether I could make this hunt.
Could Ron get better in time to make the trip right after having back surgery?
This was his goal, is to be able to get back and go on this trip with his son.
But with today's modern surgeries, not only are the minimally invasive procedures simpler and with better results, but the recovery time can be minimal as well.
Minimally invasive surgery is commonly called laser surgery. So when we make a minimally invasive incision, we're not cutting muscle, we're not cutting bone, and in that respect, I think it's state-of-the-art.
We've seen that patients are having better recoveries and ultimately better outcomes.
And once I had the surgery, I knew I could do it.
and just recovered beautifully, probably in record time.
He did great. He stayed positive throughout his entire experience. He worked very hard at physical therapy.
And we had a fantastic time.
Okay, here we are, Broadmouth Canyon. We got the mountain of Valley behind us. We're supposed to get 10 inches of snow tonight. I'm here with my dad. I love him so much. I'm glad I got the opportunity to do this with my father. First elk hunt for both of us.
Yep.
We saw some huge bulls coming in, 350, 380 class, maybe. You see him?
Yeah, I see him. Look at him. Gotta tell you, dear, I love you. You made my dreams come true more than once. And you're definitely fulfilling this one.
It's like courtship days again. We just have the best time together. We go places, do things, and we're just not hindered by his back anymore.
Fortunately, everything went well with surgery, and he's doing extremely well. Was able to make this trip, which has meant a lot to him, means a lot to me, and just a very good story.
He went on the hunting trip, and it was very rewarding to see him there with his picture. And it was very exciting to see the smile on his face when he came back and said, "Look, I did it."
Do anything I want to do. Carry corn, I climb tree stands, drive my tractor, riding a four-wheeler. I walked 4.5 miles yesterday out here hunting. Do anything I want to.
So, Angie, Ron finally got his dream trip.
I know, he did.
I guess it's always good when someone suffering from back pain has a goal to work toward.
That's right. And as you can see, Ron is a very happy and positive guy, and that really goes a long way when you're working to get better after suffering from debilitating back pain.
And Dr. Frisk just assured me at Southeastern Spine that I would be able to do it. And you know what? He's part of my dream coming true.
When we return, we'll take you on location and we'll meet people who are glad that they finally found the Southeastern Spine Institute. So stay tuned.
Because I went to 3 different doctors for this. Within the first time I went here, it was just different. It was like I was actually going to get help.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. Once again, Vanessa Hill.
Welcome back to the Age of Spinal Medicine on location. We're outside of Building B, one of the 2 buildings on the Southeastern Spine campus. And as we like to say, everything you need in spine health is under 2 roofs. We caught up with a number of patients and asked them why they came to the Southeastern Spine Institute.
There's no reason for anybody to be in pain. People can help you.
These people have more experience and are dedicated to working on the back.
They're going to help me. And I was just so grateful to find it. I couldn't really live my life like I wanted. My quality of life went down or so low that it was just tough. And after it, it's just, I'm back up, like 90%, baby, 100%.
All right, so what have you been doing?
Basically just been walking, stretching, following everything y'all told me to do.
During a visit, patients will receive a proper exam and diagnosis, which might include a digital X-ray, nerve study, or advanced MRI. The Southeastern Spine Institute has many non-surgical treatments that can often be performed in the same day.
You got it all done in one day. I've never been anywhere where you get an MRI and an X-ray and a nerve conductivity test.
Some people are afraid to come to a doctor because they think that means surgery. That's simply not true. Over 90% of back patients never need surgery, and they can heal on their own with just a little bit of help.
Physical therapy helps, and as far as instructing you on not only exercises to add to your regular routine, but also to make sure that exercises that you're doing them properly, that you're not going to make yourself worse. The injections help getting people moving again, and that it decreases swelling or inflammation around the disc and the nerves, and that removes pressure, and that can allow the patient to then become more active, which increases the blood flow, which will help you to avoid surgery or problems down the line.
While most times your back problem can be solved with simple medical treatments, sometimes because of structural issues in the spine, more is required. But as one patient told me, surgery is always the last resort.
Tried everything, had epidurals, and that worked for a good while, and everything went fine. But at this point in time, I knew from the feeling I was having in my leg that there was something seriously wrong.
Dale Haskell had been having back problems for years, but with the help of Southeastern Spine, he was still able to stay active. He invited us back to his farm in Walterboro to hear the rest of the story.
A farm here, constantly there's things to do all the time. It was never ending. Started cleaning up around here and pushing up some piles, and I'm still working. It's going to be a lot of cleanup yet to do here on this farm to get it back to the way it was.
I've known Dale for years. He's somebody that works multiple jobs. He has multiple bad discs, and eventually one day, one of those discs completely gave out and caused tremendous pain, tremendous pressure against his nerves. Dale basically was getting along okay until he blew out this disc, and that stopped him in his tracks.
My life had ceased at this point. The way my life was, I was active, I walked, I enjoyed walking, I loved the outdoors, and it got to where I couldn't do it anymore. And the fear of not ever being able to do it again and not having anybody to help me here, it was just overwhelming.
People in constant pain oftentimes hurt so much they get depressed.
People that have chronic pain really do suffer from reactive depression, where the pain that they have affects their life so much that it affects their mood.
And I would go to sleep and just, that's the only time I could get away from the pain and the aggravation of it, and the depression from it too.
I understand that you don't like to take pain medicine.
I learned this from Dr. Paletti. A lot of times when you take pain medications such as that, you mask the symptoms, and then you can actually hurt yourself and cause the problem to be even more severe.
Dale, like so many others, loved the fact that he could get everything done at the same place and the same time at the Southeastern Spine Institute.
When I got there, they had to have an MRI done. So I thought, oh my goodness, I'm gonna have to go over to a hospital somewhere, and I'm gonna have to try to figure out where this place is at. And you're not feeling good, but they take you right on in, get it done, get you out.
Most people can get everything done in one day if they come to our place. We've got everything here under one roof, actually 2 buildings next to one another. They can get every service they need.
Most times, people diagnosed with a herniated disc can get better with a simple injection, physical therapy, or a change in lifestyle. But sometimes the problem requires surgery. That was the case for Dale.
Well, in his case, we did take the pressure off of the nerve. He had ruptured the disc in such a way that we had to replace it.
But the good news was that at the Southeastern Spine Institute, they use the latest medical procedures found anywhere in the country. Avoiding cutting any muscle, an incision less than an inch long is made, and a small tube is inserted, and tiny instruments are used to correct any problems in the spine.
He was able to get up and around and back to his unusually active lifestyle pretty quickly after that surgery.
This minimally invasive surgery has shorter recovery times, better outcomes, and can all be done at Southeastern Spine's own in-house surgery center. The patient doesn't need to check into a hospital and is able to go home the same day.
I woke up out of pain, totally. When I left that day, I didn't take a single pain medication from the time I walked out till the time I came home.
Dale is someone who you feel good about being alive when you're around him.
The time the sun comes up, I have to be out doing something because I feel like I'm burning daylight. And every minute that I miss is 1 minute I'll never get back. And it was a lot of minutes I've gotten back already that I thought I'd never have. And it's because of Southeastern Spine, they gave me back my life. And I mean, what kind of price can you put on that?
Dale understood what life was like before and after back pain, and he explained how back pain can really get you down.
That's right. I'm sure there are a lot of people watching at home and they're in pain. They might have pain shooting down their arm or down their leg, and it can be really hard on them.
Well, Dale finally discovered the Southeastern Spine Institute, and he couldn't be happier.
That's one of the things we found here at the Spine Institute. The physicians and the staff really want people to know that there's hope.
If you've been told that there's nothing that can be done for your back problem and you're going to have chronic pain, it's normal to feel hopeless. At Southeastern Spine Institute, we have a number of treatments that we can offer to people, and very often we can make an impact on those people's lives, and there's nothing more gratifying than that.
And when we come back, you'll hear more from the doctors and the professional staff here at Southeastern Spine. And you might be pleasantly surprised to learn that they do understand your pain.
When you're in pain, you're depressed. And I know that firsthand now because I had a back problem, so I saw the other side.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. Once again, Angie Mazel.
Welcome back. Behind me is a typical busy day at the Southeastern Spine Institute. Here, physicians and staff working in multiple disciplines can diagnose and treat almost any type of back or neck pain, often in the same day. Because when you're in pain, it's good to know there's one place you can find all the help you need.
I was hurting going in, I feel much better coming out. They do a wonderful work here.
Yeah, I wish I would have come here sooner because I would have gained that extra 5 years that I lost with my family.
If you'd have seen me 5 years ago, my life has changed. The whole outlook of life has changed.
All under one roof, you'll find spine surgeons, neurosurgery, pain management, plus non-surgical and rehab doctors, and physical therapy. Southeastern Spine also has its own outpatient surgical center, digital x-rays, in-house MRI, plus an on-site neuroradiologist to help pinpoint your exact problem. Always one step ahead. It's not just a slogan, it's what they do here every day. So when you come to Southeastern Spine with back or neck pain, you can rest assured that you'll be receiving the latest medical technologies and procedures found anywhere in the country. We caught up with Medical Director Dr. Don Johnson to find out what makes the Southeastern Spine Institute so special.
In a practice like this, you have different doctors that have different specialties. So in a group like this, you're not just seeing the same kind of doctor. We actually have doctors that have different training, different backgrounds, different specialties. So we're able to then collaborate, not just surgeon to surgeon, but we can talk from surgeon to a rehab physician, to a radiologist, to a neurologist, to an anesthesiologist, to a pain management doctor.
This side. And when it goes up the back of your head.
Yep.
And that's unique. There aren't any other practices like that in South Carolina.
Helping people that come in with debilitating pain takes a team effort. And at the Southeastern Spine Institute, the staff takes pride in caring for the patients and seeing them get better.
I felt like somebody that was honestly trying to help, you know? You can tell when people really mean it. And they meant it.
It makes me feel great. I love to see a patient kind of have a 180-degree shift from really just being discouraged to being very hopeful in their treatment.
I love working here. Great people, great physicians, getting to help people that have had this pain for a long time, get them feeling better. It's rewarding.
It's very rewarding to come to work every day, and though there's going to be difficult days where you just feel like things are great when you have the patients come in that do really well after surgery, and I've had several say, thanks for giving me my life back.
I think anytime you go to a practice where people are happy and they work well together, the patient is ultimately going to benefit from that. And that's the end goal, is taking care of patients. And that's why I got into this profession. That's why I came here to work with this group.
Sometimes people who work here find out firsthand what patients with back pain are going through. And office manager Katie Solomon couldn't wait to tell us her story.
I was so bad, I couldn't sit down. I had to lay down or recline. And it was miserable, miserable. But of course, my doctors, I thought they were wonderful to work for, but now I know they're wonderful with patients too.
Katie started developing back problems and nerve pain a couple years ago. And she had some shots that helped, But then over a weekend, a couple weekends ago, the disc that we were treating actually exploded. A piece of the disc came out and hit her spinal cord, and her pain was off the charts.
It takes over your whole life. It takes over everything. It controls everything you do, from working to home activities.
Because we have a team and we collaborate here, we actually had 3 surgeons in her surgery. So we were able to look at her disc, take the piece of disc off. She woke up pain-free, and she's been great ever since now.
When I did, it was like a miracle. It really was like a miracle. I'm not kidding. They did give me my life back, just like the patients say.
When you're hurting, you just want to know what the problem is. So to help you get a proper diagnosis here at Southeastern Spine, they have their own neuroradiologist on staff.
Our operation is set up to give results to the patients as fast as possible, so the treatment can be given as early as possible.
Having a neuroradiologist on staff to help you get a same-day diagnosis is just another way the Southeastern Spine Institute is always one step ahead. So, Vanessa, where are you now?
Angie, I'm following another patient as she goes through her examination and treatment. And when we come back, you'll meet Philia Donaldson, who found out in most cases you won't need surgery to treat your spine issues.
They did x-rays and MRI, and then they gave me an injection, and I felt wonderful.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. And you can watch any of our Age of Spinal Medicine shows by going to southeasternspine.com and clicking Medical Documentaries. Once again, Angie Mazel and Vanessa Hill.
Welcome back to the Age of Spinal Medicine on Location. We've been talking with both doctors and patients.
As we told you, our patient, Philia, needed only a simple epidural injection to quiet her pinched nerve and get back to her daily life. In fact, 90% of the patients at Southeastern Spine get better without having surgery.
This is Dr. Richardson.
Hello here.
How are you?
I'm doing well. It's good to see you. All right. Well, we need to get you feeling better here.
That's right.
All right.
I'm ready to.
Well, just like before, we'll talk you through the whole thing so there won't be any surprises here, okay?
Our goal here is to avoid surgery if at all possible, and oftentimes we can do that. And up to 90% of patients don't need surgery. Sometimes one injection can provide years of relief and to help them maintain that active lifestyle that they want.
And that's it. We're finished.
Yes, I feel much, much better.
When Philia's husband, Charles, started having back problems of his own, Philia knew exactly what he should do.
He tried a couple things, and I said, okay, you need to go to Mount Pleasant and see someone there.
Charles listened to his wife and went to see Dr. Paletti at Southeastern Spine, and she was right. He found just the help he needed and trusted he had gone to the right place.
They sat me down and showed me on the computer that everything that was happening and what was going on and what I needed to get done. And I sat and I looked and I listened. I said, well, whatever you got to do, go ahead and do it, because I just could not bear the pain.
Just with his back hurting, he couldn't do a whole lot, so I'm used to just seeing him just happy-go-lucky, and he wasn't like that. He was always just, oh, my back is hurting or something is wrong.
I think all out is a good description of Charles Donaldson. He's somebody who's worked as a traveling salesman. He's in his car all day long. That's an occupational hazard when it comes to your back.
I'm in and out of the car all day, every day. Probably work about 25 customers a day.
And he developed shooting pain down his leg. He had sciatica, which was interfering with his ability not just to drive and to work, but with his ability to live.
I have been singing in the choir all my life. It made me feel real sad to just see them singing and I wasn't in there. I just thought that I got to be in there. And with the pain that I was having, I could not deal with it.
Prolonged standing can cause the pain to shoot down your leg. And if you've never had sciatica, the pain from nerve compression like Charles had is unremitting, it's unforgiving. It can cause pain which keeps you up at night, which interferes with your ability not just to work, but it interferes with your ability to function.
But I was dealing with it, but then I stopped one day and I said, I got where I couldn't hardly go at all, and I said, I got to do something real quick, because I know I'm getting up in the age, but at the same time, it's not that time yet.
When we first saw Charles, we wanted to try an option other than surgery. And so we tried to do some nerve blocks on him, where we can put cortisone over the nerves to decrease the swelling in the nerve, to decrease the pain that someone feels from sciatica. And much of the time it works, but in a situation like Charles, where he has this type of sciatica and this type of nerve pressure, sometimes an injection won't do the trick.
Unlike Felia, Charles did need surgery to get back to his active life, but the good news was that at the Southeastern Spine Institute, they use the latest medical procedures found anywhere in the country.
Frequently, the surgeries they do, patients will be out of the hospital same day, up walking around maybe an hour after surgery. So it's absolutely fantastic to see somebody who just a day before was in agony now feeling no pain at all.
When I woke up, I didn't have any pain, none. It disappeared. I was wide open ever since. I've never had a pain since then, and I've just been going wide open ever since.
I can't keep up with him. He's just on the go all the time now, so I'm just happy. They did a great job.
And now Charles is back to his passion of standing and singing in the choir. Let's check in.
Oh, Lord.
Well, Vanessa, with all of the success stories, I hope that we've shown the viewers who may be suffering with pain that there's hope.
That's absolutely right. And with the latest technologies and advancements in spine care, neck or back pain shouldn't limit your life.
And we found that the physicians and the staff here at Southeastern Spine really do care about their patients. And a good attitude goes a long way when you're recovering from back pain.
Speaking of that, Angie, we're going to end the show with a look at the people who had the great attitudes, all because of the help they received at the Southeastern Spine Institute.
We'll see you next time.
Bye-bye.
But you've got to listen to what the doctor says, follow his instructions, and have that positive attitude about it too, because if you don't have a positive attitude, it's like you're wasting your time.
We know we have something for everyone, and therefore we can give hope to the patients.
I have so much confidence in him. It's tremendous. I mean, if they told me it was going to rain, I'd get an umbrella.
I'm starting to feel very strong, so I think I'm going to be back on that court.
One's attitude and state of mind affect how you get better.
If you have a positive attitude and you have an open mind and you're willing to try, you'll get there.
This will turn your life around. It really will. It can help you out so much if you just give them the time to take a look at you and you don't give up on the doctors and you come here, you'll be doing good.
For more information on spine health, visit southeasternspine.com or call 866-SPINE-50 for an appointment. And you can watch any of our Age of Spinal Medicine shows by going to southeasternspine.com and clicking Medical Documentaries.